Hello, Sojourner Health Clinic volunteer. Welcome to Osler, an open-source, browser-based electronic medical record system developed at the Washington University in St. Louis by students, for students. Hello, everyone, and welcome to our video on adding a new patient. So if you've made it this far, we assume that you have figured out how to access Osler, log on, and view the overall software. If you're still having troubles with that, make sure to check out our general overview video. So if you're working on adding a new patient, you're most likely a triage student or some other type of student who's intaking patients. There's two ways we would have a new patient. One, they're completely new to our clinic and they need a chart. Two, this patient has been seen in our clinic before, but we only have a paper chart for them and it's up to you to input them into our system. So first, let's take a step back. Let's look at our intake form. Remember, this is a paper form that everyone is filling out for every patient. Name, date of birth, and then you're going to circle new patient, return patient, or if they need refills or not. So if it's a new patient, that's what this video is for, and we'll get into more details on how to log the intake information. If it's a return patient, you have to make sure to confirm the demographic information and patient survey information. Please check out the appropriate video in our video list to make sure you're up to date on how to do that. So now let's dive into what to do if you have a new patient. Let's go back to Osler. Now you'll see at the top left of the screen, there is a button for new patient. We'll press that. Now you're going to type in the patient's name, Casey Rue. Now if I press submit, you'll see that Casey Rue already has a chart. So this is the system's way of making sure that there's not already a patient with that name. So my bad, I didn't want to intake Casey Rue. I'll press cancel. Now I'll go ahead and press new patient. Our new patient today is John Smith. So when we type in John Smith's name, now we're here. Now you're going to ask the prompts to the patient. So, Mr. Smith, do you have a middle name? Yes or no? Okay. What is your cell phone number? Now you'll type in their cell phone number. It's very important that we actually have a contact information method for each patient. So that could be phone number, that could be email. There's a spot for email further down. Languages. What languages do you speak? What is your preferred gender? What is your address? So if our patient has their own address, definitely include that into the system. Otherwise, you can go ahead and put in the default address of the church, 205 East 9th Street, Kansas City, Missouri, 64106. Then you'll go ahead and put in the date of birth. Mr. Smith was born October 1st, 1990. You'll then go ahead and select ethnicities by asking the patient. If they have more phone numbers to provide for you, you can input them here. And then you'll also ask them their preferred contact method. Once again, there is an email field. We want at least one form of contact. If you don't have a phone number, get an email. If you have a phone number, you don't necessarily need to put an email. Once all that information is filled out, you'll press submit. So that was the demographic information. Now we're on to the patient survey information. So these are questions such as, do you have insurance? Yes or no. Have you visited the ER in the past year? Yes or no. If so, when was that visit? Chronic conditions. What chronic conditions do you have? You'll ask them to list them. You don't have to go through every single one of these, but just go ahead and ask them for the big ones. And if they bring up any other ones, you can definitely find them here. John Smith has hypertension, coronary artery disease, and asthma. If you're seeing any chronic conditions that might be missing, go ahead and let a manager know, and they'll add it for you. Social questions. Does your patient live alone? Yes or no? If no, how many dependents do they have? Do they have access to these resources? So transportation, grocery stores, some kind of housing situation. A follow-up to the transportation question is, what is your primary method of transportation? Employment status. So we want to know, are you currently employed? Yes or no? What was the highest level of education you received? What is your work status? So if you're unemployed, are you looking for employment? If you're employed, are you full or part-time? And then what is your annual income? A significant portion of our patients are unemployed and have a $0 income. So this is what you would select for them typically. Then you'll go ahead and press submit. Congratulations, you have successfully created a patient profile for John Smith. You'll see it looks just like everyone else's patient profile, complete with their name, age, race, gender, and then the demographic information. All your survey data can be found here. So now we'll go back. And so congratulations, once again, you have created a new patient. Be sure to check out our other videos on how to edit this information appropriately. Thanks.